So the topic before us today is inguinal canal and inguinal triangle. It's a very important topic, but I've created a mnemonic that can help you know the ways you can actually write on tracks, triangles, spaces, cavity in the body. And today, the essay we'll be looking at is describe the gross anatomy of the inguinal canal, compare and contrast the anatomy of the direct and indirect inguinal hernia. Now, this mnemonic is ABC, all I need to know, boundaries, content, and clinical correlation. Now, for inguinal canal, all you need to know is that the inguinal canal is an oblique intramuscular passage about 4 cm long, lying above the middle half of the inguinal ligament. Now, the inguinal canal can extend from the deep inguinal link to the superficial inguinal link, and it is directed downward, forward, and medially. So, just knowing the location and knowing that it is an oblique intermuscular mass is enough to fetch you 3 points, as that can form your introduction and definition in the essay asked. Now for boundaries, the boundaries of the inguinal canal are it have an anterior wall. It is formed by from superficial to deep, the skin, the superficial fascia, the external oblique aponeurosis, the internal oblique muscle fibers, and the posterior wall formed from deep to the superficial by the fascia transversalis, the conjoined tendon, the deflected part of the inguinal ligament in the most medial part. Now the roof of the this inguinal tract is formed by the lower arch fiber of the internal oblique and transverse abdominis muscles, while the floor is formed by the grooved upper surface of the inguinal ligament into the whole extent, abdominal surface of the lacunar ligament at the medial end. Now you might have been looking at these, trying to know how do I remember all these. Mnemonic here can help you remember everything you need to know about the boundaries of the inguinal ligament. And this mnemonic is MALT for M, which is the roof, A for anterior wall, L for floor, T for posterior wall. So M is Moses. For it from the roof, we have the internal oblique and transversus abdominis. The A represents A2. A forms the anterior wall. We have the aponeurosis of the external oblique muscles and part of the internal oblique muscle. So the aponeurosis of these muscles form the anterior wall. Now for the floor, which is L, it is formed by ligaments. L for ligaments, L for floor, L for lower part. It's formed by inguinal ligaments and lacunar ligament medially. Now for T, which forms the posterior wall, is formed by transversalis fascia and conjoined tendon. With all this, you can actually remember the boundaries of the inguinal ligament without trying to cram all the muscles there. With MALT, you can do that free, and it can help you fetch 3 points and give you confidence while writing an essay exam. So with MALT, can help you do a lot of things. M for muscle, which represents the roof. A for anterior wall, which represents the aponeurosis. L for lower segment of floor, which represents ligament. T for posterior wall, which represents transversalis fascia. Now, for the next thing, the contents, as we said, A, B, C, all I need to know, boundaries and content, clinical correlation. Content in male contains the spermatic cord and the iloinguinal nerve, while for female contains the round ligament of the uterus and the iloinguinal nerve. Now, there's something you need to know here is that the iloinguinal nerve doesn't pass through the inguinal canal through the deep inguinal ring. Doesn't pass through the deep inguinal ring, although it's a content of the inguinal canal, but it doesn't pass through the inguinal ring. It enters the canal through a slit between the external and internal oblique muscles. It enters through the slit between the external and internal oblique muscles, who it lies in front of the cord and passes throughout the superficial superficial inguinal link to supply the inguinal region. So I just want you to know this because it's very important. It can be asked in MCQ. The inguinal nerve only passes through the superficial canal. It doesn't pass through the deep canal, and it passes between the internal and external oblique muscles. You might wondering, how can I remember the muscles? Remember MALT, which is the boundaries. You know that the muscles in the inguinal canal is internal oblique. So if you can remember internal oblique, just know that that this inguinal nerve passes between the internal oblique and the external oblique. So it can help you know the muscles of the abdominal wall where this inguinal nerve passes through to get into the inguinal canal. Now this is a diagram showing the inguinal canal. Remember, if you are asked to write an essay on anything in the body, the anatomy, you must always sketch the diagram. Now, the inguinal canal, this is a special thing I want to talk about here in the inguinal canal. This can be an essay, this can be a question on its own. They can ask you to write a short note on the inguinal canal, then also add notes on the mechanism to maintain the integrity of the inguinal canal. So this can be a sub question on its own. They can ask you to add notes on the mechanism to maintain the inguinal canal, and this is the mechanisms. We have the flap valve mechanism. The oblique orientation of the canal prevent the deep and the superficial inguinal ring from aligning to increasing abdominal pressure, so bringing about the anterior and posterior wall together, acting like a flap. So this is a flap valve mechanism due to the oblique orientation of the inguinal canal. Now the next mechanism is the guarding of the inguinal canal. The deep ring is protected anteriorly by the internal oblique muscle, while the superficial link is reinforced posteriorly by the conjoined tendon and the reflected part of the inguinal canal. So the guarding mechanism there are some muscles and ligaments that protect the inguinal ring. The next is the shorter mechanism. The inguinal oblique muscles form a flexible arc around the canal. When it contracts, the roof is pulled down to the floor, causing the canal to shorter. So these mechanisms help to maintain stability of the canal. Then the next mechanism is slip valve mechanism. Now the contraction of the external oblique muscles brings the middle and the lateral chorial of the special link together, acting like a slip valve. So this intercrural fiber assists in the closure of the slip valve mechanism. The next mechanism of protection is the ball valve mechanism. Now the contraction of the cremaster muscles pull the texts up, allowing the spermatic cord to block the superficial inguinal ring. That's the mechanism. The next mechanism is the interfoveolar ligament. And this strengthens the fascia transversalis laterally by acting from the transversus abdominis to the superior pubic ramus, acting as a functional middle edge of the deep inguinal ring. Now, here I will give you a mnemonic that will help you remember this mechanism of action, this mechanism that helps maintain the stability of the inguinal ligament. And the mnemonic is friendly guard, short, sleep boldly. Friendly guard, short, sleep boldly. Flap valve for friendly guard, guarding the inguinal ring. Shorters mechanism, sleep valve mechanism, and ball valve mechanism. Mnemonic friendly guard, short, sleep boldly. Next is the spermatic cord. I want to say that the spermatic cord is a collection of structure that pass through and through from the testis through the inguinal canal. Now it has a content spermatic cord. It has 6 groups of structures. It have the ductus deferens in the posterior part. That's the three arteries, which is the testicular arteries, cremaster arteries, and artery of the ductus deferens. And with the mnemonic DCT, we can remember this artery, ductus deferens artery from the inferior vesical artery, premasteric arteries from the inferior epigastric arteries, then testicular arteries from the abdominal artery. And the next is the vein. It has a pampiniform venous plexus. The next is the lymphatic, especially from the texas, draining into the pre or para-aortic nodes, and some from recovering around, draining into the external iliac node. Now the next is the nerve. It has genital branch of the femoral nerve and a sympathetic fiber which accompanies the artery. The remaining is the remains of processus vaginalis. And these are the six contents that is seen in the schematic cord. Now looking at this diagram from outside, you can see the covering of the spermatic cord, the external spermatic fascial, the cremasteric fascial, and the internal spermatic fascial. That's the covering. It has three coverings of the spermatic cord: external, cremasteric, and internal. So for this, we have this is the ductus deferens. Remember, we have three arteries: the DCC, the artery to the ductus deferens, the testicular artery, and the cremasteric artery that supplies the cremasteric fascials. Then the ductus deferens must have an artery that supplies it. Now, there is also the pampiniform venous plexus and ligaments surrounding the ductus deferens. This is the vein. The next is the nerve. We have the cremasteric nerve and inguinal ligament nerve. This is the nerve. It also has a sympathetic nerve. Then the next is the space. This is the remain of the processus vaginalis. The remain of the processus vaginalis. And these are the contents of the schematic code. I hope you enjoyed this video. Please, if you have other mnemonics that have helped you to remember all these high concepts about schematic code, please you can post it. You can write it down in the comment section. If you enjoyed this video, like, share, subscribe, and turn on the notification bell to know when I update or when I post new content. Thank you for watching.